So in today's lecture, we will be looking at the extraordinary points. So the extraordinary points do not belong to any one of the 14 main meridians. This is the 12 meridians that we covered, plus the Du and the Ren meridian. And according to different textbooks, there may be different amounts of extra points, but we will only be covering 48 extra points. And how these points are classified is according to their location. So what happens is that they've grouped the different points according to different regions, such as the head and neck, the back and waist, or the chest. And also what happens with these points, which doesn't happen with the other points we have done, is that one name can have multiple points. For instance, the first point we will be covering, Zishen Kong, is actually 4 points, all located around Du 20. And then lastly, there is no standard on naming these points. So what you will see is that different textbooks may use different methods for classifying their points. And in the next slide, we'll look at the 4 main ways that the points are classified. Here you can see the 4 different types, and I've given a short explanation on what they mean. So if we look at the first one, which is the one we will be using, and the most commonly used, this is EX-HN1. So the EX is abbreviation for extra point, and it's in front of all the points, no matter where they're located. There will always be the prefix EX. And then there's a dash. And after the dash, there are 2 letters, which are the abbreviation for the region that the point is located in. So for our example, you'll see it's the H and N, which means it's in the region of the head or the neck. And then the last bit of it, the number, so in this example it's a 1, this number refers to a specific point, and it's normally standard, but it can sometimes vary in different textbooks. And then here's 2 more examples just to give you an idea. So if we look at the first example, it's EX-LE1. So what this stands for, again, EX is again the same abbreviation for extra points. And then the LE is the lower extremity, and it's the first point. The next one is EX-B4. So the EX again, extra point, dash, B for back, and it's the 4th extra point. The next way you may see the points are named is the M-HN-1. So the M is the abbreviation of the extra points, and it's similar to the EX. It's the abbreviation that's going to be in the front of all the points. And then this one has a dash, and then the HN, which is the same as the previous one. It's just the abbreviation for head and neck. And this will change depending on where the points are located. And then the numbering after the second dash is the same. It's to classify specific points. So I've done 2 more examples here. M-CA-1. So M is the prefix. CA stands for chest and abdomen. And -1, it's the first point on the chest and abdomen. The same for M-BW-24. So M is the abbreviation. BW is for back and waist. And -24, it's the 24th point on the back and waist. The next standard you might see is EM1. So the EM is the abbreviation for extra points. And then they don't use a secondary abbreviation based on the location. They just use a numbering system. So no matter where the points are located, they will all use the same numbering system. So it'll just be EM1, EM2, EM3, all the way down to the last point that is classified in that textbook. And the 4th and final way you might see points classified is according to their Mandarin name. So like the point we've been doing here, EX-HN1, its Mandarin name is Zishen Kong. So this is the standard Mandarin name, and this is also quite standard, as most textbooks use the same name. In my notes, I use the first method combined with the Mandarin name. And this is to make it easier for you to identify the points in other textbooks. And then I give 2 other examples, such as Taiyang or Yuyao. So these are all the abbreviations you'll see. The first one, EX-HN, this stands for extraordinary points, and the HN stands for the head and neck. The second one is EX-CA, and this stands for extraordinary points of the chest and abdomen. Thirdly, EXB stands for extraordinary points of the back. And fourthly, it's EX-UE, which stands for extraordinary points of the upper extremity. And then the last one, EX-LE, stands for extraordinary points of the lower extremity. So the first set of points we're going to look at, these are the extraordinary points of the head and neck, EX-HN. So here you'll see an example of how a point's name will be written out. So on this first point, I've called it Zi Shen Kong, so that's the Mandarin name. And then in the brackets, I've given you the standard English numbering system that we use, which is EX for extra point of the head and neck number 1. So Zi Shen Kong consists of 4 points in total, and they are 1 Tsun anterior, posterior, and lateral to Bai Hui, do 20. So as you can see, here's the first point. So this point is anterior to do 20 in this direction. That's the first point. Then there's the 2 lateral on either side, here and here. And the final point is 1 Tsun posterior to do 20 over here. So remember, even though this is one name, it's actually for 4 individual points. These points can be used for headache, dizziness, insomnia, amnesia, epilepsy, and other mental disorders. They can also be used for eye disorders. Our insertion is horizontal, 0.5 to 0.8 Tsun. And remember, you can't go deep on these points because of the skull. The next point is Dangyang, EX-HN2. This point is located on the anterior aspect of the head, directly above the pupil, 1 Tsun posterior to the anterior hairline. So we're going to use the line here directly above the pupil, and then we know it's going to go 1 Tsun posterior to the anterior hairline. So here's the anterior hairline, and we've got to go 1 Tsun posterior to it. And there was another point we found in a similar way to this point, except it was on the forehead. And this is GB14, which was also directly above the pupil, but it was 1 Tsun above the eyebrow over here. So Dayang can be used for migraines, aching all over the head or dizziness, and then swelling and pain of the eyes. Our insertion is horizontal, superiorly, so in this direction, and it's 0.5 to 0.8 Tsun. The next point is Yintang, EX-HN3. So this point is located at the midpoint of the medial ends of the eyebrows. So here's the 2 medial ends of the 2 eyebrows, here and here. And then we've got to find the midpoint between these 2 points over here. This point can be used for dementia, epilepsy, insomnia, amnesia, and other mental disorders. It can also be used for epistaxis and rhinorrhea. And thirdly, it can be used for infantile convulsions, postpartum syncope, and eclampsia. The needling is horizontal insertion, 0.3 to 0.5 Tsun, inferiorly. So that means in this direction. The next point is Yu Yao, EX-HN4. This point is at the midpoint of the eyebrow. So don't confuse this point with Yin Tang. Yin Tang was at the midpoint between the medial ends of the eyebrows over here. This point is at the midpoint of one eyebrow. So there's 2 points, one on each side. So what we do is we got to find the lateral end of the eyebrow over here and the medial end of the eyebrow over here. And we got to find the midpoint between these 2 points. And this is usually directly above the pupil if the eyes are looking straight ahead. So this point can be used for local conditions affecting the eye, such as twitching of the eyelid, redness with swelling and pain of the eyes, pitosis of the eyelid, corneal cloudiness, deviation of the eye and mouth, and other diseases of the eye. The insertion is horizontal, 0.4 to 0.6 Tsun, either towards the medial or the lateral end of the eyebrows. So that's in this direction, laterally, or this direction, medially. The next point is Taiyang, EX-HN5. This point is located on the temple, which is this region. And it's in the depression 1 Tsun posterior to the midpoint between the lateral end of the eyebrow and the outer canthus. So if we zoom in here, this is the outer canthus over here. And this is the lateral end of the eyebrow over here. So we got to divide this distance in half to find its midpoint. And then we got to go 1 sun posterior to this. This point can be used for headache, eye diseases, and facial paralysis. So the insertion is oblique inferior insertion, 0.3 to 0.5 sun, or we can prick this point to cause bleeding. The next point is Erjian, EXHN6. This point is found on the ear. When you fold the auricle forward, this point lies at the apex of the ear. So it's over here. This point can be used for eye diseases, headache, or sore throats. Our insertion is perpendicular, shallow insertion, 0.1 to 0.2 tsun, or you can prick this point to cause bleeding. And note here that the insertion must be very shallow as we're going into the ear here, and there's not a lot of flesh here to go into. The next point is Chihuo, EXHN7. This point is along the inferior border of the orbits. So this is the inferior border of the orbits at the junction of the lateral quarter and the medial 3/4 of the infraorbital margin. So as you can see here, they divided the infraorbital margin, which is the lateral end of the orbits and the medial end of the orbits, and we divided into 4 equal parts. And then we've got to have 3/4 on the medial side, 1, 2, 3, and 1/4 on the lateral side. And then this point lies just over here. So this point can be used for any type of eye disease. Our insertion, so once again, it's a special insertion for this point. So what we have to do is push and hold the eyeball to the medial side. So that means you're going to push it towards this side with your palpating hand. And then you're going to slowly insert the needle with the needling hand 0.5 to 1.5 tsun along the inferior side of the orbit. So remember, that's this side here. There's 2 cautions when needling this point. Firstly, you do not use lifting and thrusting method, as this can damage either the eye or the underlying blood vessels. And secondly, to avoid bleeding after you withdraw the needle, apply pressure to this point for 1 to 3 minutes after the needle has been withdrawn. The next point is Xiangying Xiang, EXHN8. This point is also more commonly known as Bitong. And this point is located in the depression at the highest point of the nasolabial groove. So here's the nasolabial groove, and we've got to follow it all the way to the high point around here. And this point is used locally for conditions of the nose, such as rhinorrhea or nasal furuncles. So the insertion on this point is oblique insertion, 0.3 to 0.5 tsun, superiorly and medially. So that's in this direction. The next point is Neiying Xiang, EXHN9. This point is located inside the nostrils, and it's on the mucous membrane at the junction of the cartilage of the alanasi, so that's this part here, and the nasal concha, which is this part of the nose. This point can be used for diseases of the nose or swelling and pain of the eyes. And once again, we don't needle this point, we prick this point to cause bleeding. The next point is Juquan, EXHN10. This point is located in the mouth at the midpoint of the dorsal midline of the tongue. So it's the midpoint between here and here, and here and here. This point can be used for stiff tongue, flaccidity of the tongue, and ageusia. And our insertion is perpendicular, 0.1 to 0.2 tsun, or once again we can prick this point to cause bleeding. The next point is Huaikuan, EXHN11. This point is also located in the mouth at the midpoint of the frenulum of the tongue. So here's the frenulum of the tongue over here, and we've got to find the midpoint of it around here. This point will be used for swelling of the tongue, flaccidity of the tongue, and once again we don't needle this point, we prick this point to cause bleeding. The next point is actually a combination of 2 points. These are Jinjin and Yuye, EXHN12 and EXHN13, and this point is also located in the mouth on the 2 veins under the tongue. Jinjin is on the left, over here, and Yuye is on the right, over here. These 2 points can be used for aphasia with a stiff tongue, swelling of the tongue or sore mouth. It can also be used for vomiting, and these 2 points are also not needled. We only prick these points to cause bleeding. The next point is Yimeng, EXHN14. So this point is located on the neck, 1 tsun posterior to Yifeng, Sanjiao 17. So here's Sanjiao 17 on the image. We've got to go 1 tsun posterior to this, over here. This point can be used for eye diseases, tinnitus, insomnia, and headache. And our insertion is perpendicular, 0.5 to 1 tsun. And that's all the points on the head and neck. Next, we're going to look at the extra points on the chest and abdomen. These points are abbreviated as EXCA for chest and abdomen. So the first and only point on the chest and abdomen that we will be doing is Zigong, EXCA1. This point is on the lower abdomen, 4 tsun below the center of the umbilicus. So here's the umbilicus. We're going to go 1, 2, 3, 4 tsun, which is level with Ren 3. And then we've got to go 3 tsun lateral to Ren 3, and that's over here. This point can be used locally for prolapse of the uterus, infertility, irregular menstruation, dysmenorrhea, and abnormal uterine bleeding. Our needling is perpendicular, 0.8 to 1.2 tsun. Next, we're going to look at the extra points of the back. This is abbreviated as EX-B. The first point is Dingchuan, EXB1. This point is located 0.5 tsun lateral to Da Jue, Du 14. So once again, we're at Du 14, and we're going to go 0.5 tsun lateral to this, over here. This point is indicated for tachypnea, cough, pain of the shoulder and back, and stiff neck. The insertion is perpendicular, 0.5 to 0.8 tsun. The next set of points is called Huatou Jiaji, EXB2. So these points are a collection of points that are all 0.5 tsun lateral to the lower border of the spinous process. And they run from the first thoracic vertebra to the 5th lumbar vertebra. So from T1 up here all the way down to L5. And this means that there are 34 points in total, 17 on each side. So the indications of these points: the first set from T1 to T4 can be used for diseases of the lung and upper limbs. The second set from T4 over here down to T7 can be used for heart diseases. And then from T7 to T10 can be used for liver and gallbladder diseases. And then T10 to T12 for stomach disorders. And from L1 to L2, kidney disorders. And then L3, L4, and L5 can be used for bladder, the large intestine and the small intestine disorders, and disorders of the uterus, and finally disorders of the lower limbs. Insertion for these points is perpendicular, 0.3 to 0.5 tsun, or you can use the cutaneous needling technique. The next point is Wei 1 Xia Shu, EXB3. So this point is located 1.5 tsun lateral to the lower border of the spinous process of the 8th thoracic vertebra. So if you remember from your bladder lectures, so there was no point lateral to the lower border of the 8th thoracic vertebra. And Wei 1 Xia Shu can be used for pancreatitis, stomach ache, pain in the abdomen, chest, and hypochondriac regions. Our insertion is oblique insertion, 0.3 to 0.5 tsun. The next point is Pigen, EXB4. This point is located on the lower back, below the spinous process of the first lumbar vertebra. So here's L1, and we've got to go to its lower border, and then we've got to go 3.5 tsun lateral to the posterior midline. And level with this point at the spinous process of L1 is bladder 22 and Huangmen bladder 51. Bladder 22 is 1.5 tsun lateral, and bladder 51 is 3 tsun lateral, and Pigen is 3.5 tsun lateral over here. The indications for this point: it is used for lower back pain. Our insertion is perpendicular, 0.5 to 1 tsun. The next point is Xia Ji Shu, EXB5. So this point is on the midline of the lower back, below the spinous process of the third lumbar vertebra. And once again, when we did the due meridian, you'll remember that we skipped quite a few vertebrae when we were going up the spine. So this is one of those spots where there wasn't a point from the due meridian. And Xia Ji Shu can be used locally for lower back pain, difficult urination, and nocturnal enuresis. Our insertion is perpendicular, 0.5 to 1 sun. The next point is Yao Yi, EXB6. So this point is also on the lower back, but it's 3 tsun lateral to the lower border of the spinous process of the fourth lumbar vertebra. So we're going down 1, 2, 3, and 4 over here, which is level with bladder 25, and this time we're going to go 3 tsun lateral. This point can be used for back pain and irregular menstruation. Our insertion is perpendicular, 0.5 to 1 sun. The next point is Yaoyan, EXB7. This point is located in the depression, 3.5 tsun lateral to the lower border of the spinous process of the fourth lumbar vertebra. So this is very similar to Yao Yi, except we're going 3.5 tsun now. So we're just slightly lateral to Yao Yi. And this point can also be used for lower back pain, but it can also be used for irregular menstruation, leukorrhea, and diseases due to Zangfu deficiencies. Our insertion is perpendicular, 1 to 1.5 tsun. The next point is Shi Qi Jui, EXB8, and this is in the depression below the spinous process of the fifth lumbar vertebra, over here. This point can be used for pain in the waist and lower extremities, and paralysis of the lower extremities. It can also be used for metorrhagia and irregular menstruation, or for dysuria. Our insertion is perpendicular, 0.5 to 1 tsun. The next point is Yao Qi, EXB9. This point is on the lower back, 2 tsun directly above the tip of the coccyx. So here's the tip of the coccyx. We're going to go 2 tsun directly above this. And this is in the depression of the sacral horn. So you see here, this is the sacral horn over here, this piece here. We're in the depression that it forms. This point can be used for pain in the waist and lower extremities, and paralysis of the lower extremities. It can also be used for metorrhagia and irregular menstruation, or for dysuria. Our insertion is perpendicular, 0.5 to 1 tsun.